I'm going to demonstrate a technique I like to use to mobilize the occiput on C1 or the atlas to mobilize the craniovertebral joint. I'm going to demonstrate a flexion technique, bilateral flexion with a posterior glide of the head, and then I'll demonstrate a unilateral flexion looking at just the right OA joint or craniovertebral joint. So I'll show you on this skeleton model, and then I'll show you on the real model. So I'm going to put one hand on the back of C1. So I'll find the C2 spinous process and just go right above it. And I'm going to broadly block the whole posterior aspect of C1 so it can't go to the floor. Then I'm going to cradle the occiput here. Notice how close together my right and left hands are. I'm right on the joint line between the head and C1. I'm going to flex the head to the barrier. Again, a lot of people are really stiff into flexion at that craniovertebral joint. So I'll flex to the barrier, and then I put my shoulder on the person's forehead to give them a posterior glide of their head relative to a fixed C1 that does not go posterior. It's pretty comfortable. I'll do that on model's head here. So again, my left hand, I find C2, I slide right above C2, superior to it, so I'm blocking the whole posterior aspect of C1 as much as I can get on. Make sure that's comfortable for the model or patient. And then my right hand is going to scoop to the base of the occiput. Again, notice how close together my right and left hands are. So I'm going to block with my left hand, I'm going to move with my right, I'm going to pull his head into a little bit of flexion at the OA joint or craniovertebral joint, and then I'll put my shoulder on your head. Sometimes I'll put a little bit of a towel or a pillowcase there to pat it. So again, blocking C1 with my left hand, flexing his head in my right hand, and then I can give a posterior glide of his head relative to C1. I can also take that, focus on just his right craniovertebral joint. I can add a little bit of right rotation, left side bending, shift my blocking hand on C1 to the right aspect of the posterior arch of C1. Take my right hand, come to the right part of his occiput. So I'm on the right side of C1, right side of his occiput. He's in a little bit of left side bending, right rotation. Again, I'm going to flex. My hands are close together. Flex his head, and then I give a posterior glide from my right shoulder, moving his whole occiput posterior on the right side over C1 to increase flexion of that right OA or craniovertebral joint.